Folks, Nick the Nurse here. Today we're going to be talking about some of the nursing interventions associated with the nursing problem of hypervolemia or fluid volume excess. Now with hypervolemia or fluid volume excess, there are a lot of interventions that you as a nurse are going to need to be able to identify on nursing school exams or on the NCLEX. Now, first of all, you want to make sure that you monitor intake and output. Why? Because the patient might be retaining fluid. You want to make sure that you restrict fluids as ordered, of course. Restrict sodium intake as ordered, because remember, sodium leads to fluid retention in the body. That's why people who say, oh, I feel bloated, well, they might have a lot of salt that they ate that day. So salt contributes to water retention in the body or fluid retention. Assess for pitting edema, particularly in the lower extremities. Monitor skin integrity. Elevate the head of the bed, right, to make sure that we get good ventilation in the lungs if they do have water that's building up. Remember to assess for crackles in the lungs. Those can be indicative of fluid volume excess or hypervolemia. We want to make sure that we monitor vitals and orthostatic vitals as well. We want to make sure that we take daily weights. And I know this might seem like a little piddly nursing intervention, but really daily weights are extremely important because it'll allow the physician working with you in conjunction with the nurse to determine if the patient is putting on fluid. And we want to make sure that we monitor for that, okay? Assess breath sounds. We kind of touched on that already with crackles and wheezing as well. We want to assess for that. We want to administer oxygen. Administer diuretics. Why would we want to administer diuretics? Well, we would want to administer diuretics because the patient's going to have a lot of fluid, and we want to make sure that that fluid moves off the body so that the heart and the lungs and the rest of the body can adequately handle the fluid that's already there. We just would rather them void that out. And remember, with diuretics, we need to watch our potassium, particularly with loop diuretics like Lasix and Bumex and stuff like that. And remember, if the patient has hypokalemia, we might want to talk to the physician or advocate that the patient be on a potassium-sparing diuretic like aldactone. So keep that in mind as well. And we also want to make sure that we measure for or monitor for electrolyte imbalances like we just discussed, and also measure abdominal girth if the patient, especially in liver and kidney failure, and more so liver failure, puts on ascites or excess fluid in the abdomen, something that we should look out for as well. So a lot of good stuff to pay attention to. I, myself, if I was a sadistic nursing instructor or nursing professor, and some of my students in the past have said that I am, what would I test you on? I would probably test you on monitoring the patient's intake and output, right? We want to make sure that those match, that one isn't greater than the other. Fluid restriction is a big thing. I know in my nursing practice, we like to make sure that we put a fluid restriction sign, usually on the door and or above the patient's head of their bed. That's per unit or facility protocol, so you want to check to make sure what the rule is on that where you work. But anyway, that's a big thing as well. Sodium intake, also big. Assess for edema. Again, the wheezing or the crackles, which can indicate that the patient is putting on fluid. With the lungs, very, very important. I think that's probably one of the more tested concepts on nursing school exams that you need to remember and be familiar with. So again, a lot to understand there. My name is Nick the Nurse. I'd like to thank you again for watching my video today. If you'd like to check out any of my other completely free videos, they're all at www.nickthenurse.com. Again, that's www.nickthenurse.com. Or you can subscribe to my YouTube channel at Nick the Nurse. Thanks again for watching, and we'll see you next time.